Everyone is talking about weight loss drugs these days. They have exploded in popularity in recent years, and the GLP-1s have just earned a new show of support this week. The World Health Organization announced just Monday it's now recommending GLP-1s as part of a way to manage obesity in adults. And joining us today to talk about this is Dr. Frank Shea with the Denver Center for Weight Loss and Bariatric Surgery. Thank you for coming. How was your drive-in in the snow?
Oh, actually, it wasn't bad. As Corey said, the traffic is less right now, so folks, now's the time to drive.
Well, thank you for braving the drive-in. We have talked with you before about this class of drugs, but for people who are just sort of learning more about it, how do they work exactly? How are they dropping weight in people and dropping it so quickly and dramatically?
The GLP-1 drugs, which stands for a glucagon-like peptide, actually is a tremendous advancement in combat against obesity. Because prior to this medication, the medications were not that effective in helping us reduce our weight. However, with this new insulin-derived glucagon-like peptide medications, we've seen profound results with weight loss and durable weight loss as well. And this, of course, Jennifer, has a huge impact on our national health.
Is this something where it's simply an appetite suppressant, or is it doing like some chemistry in the body to help people drop it? What is going on in the body with these meds?
It turns out that obesity is as complex as cancer, and that there is no one magic bullet that's going to take the disease away. But because of the complexity involved, that's where the research led to GLP-1 compounds that led to really effective weight loss. Now, the research is still ongoing. We're discovering new hormones to work on. And these hormone drugs are becoming very effective, sometimes even reproducing some of the surgical results. Interesting.
Okay. Very popular. Every celebrity we can see these days is doing this, but also 1 in 8 adults are now just across the country, report using these drugs. Who would be the person who you would recommend this for? And I want to be very clear, the recommendation is not just take the meds. It's the meds and what else?
You bet. What's important about the WHO declaration recently is that prior to Monday, they did not fully endorse GLP-1 drugs. But now, with the profound data and the outcomes that came, we've seen a reduction in heart attack and stroke with use of these wonder drugs, really. And because obesity is such a prevalent problem now in our country and the world, that WHO was forced into making a declaration like this and embracing GLP-1. So I think accessibility, Jennifer, is still the issue right now. It is still high cost. But I think actually our federal government, like Medicare, Medicaid, is working hard to make it more affordable.
You kind of already speaking to the cost burdens. I do hear that these are expensive, but each new designation recommendation can potentially lead to an impact we would see down the line for the consumer.
Yes, and this is why the WHO declaration is so important to us. This will force the industry involved to lower the cost because accessibility is still an issue. It's a great drug. There are some side effects that we have to monitor with physicians. However, it's going to do much more benefit to society than any harm.
I know several people in my life who are also taking these, and a lot of people are older adults who've struggled with their weight, or they have heart conditions or have pre-diabetic. Like when we hear about these, I think it seems like just about anybody could have that conversation with their doctor. Who is the ideal candidate in your mind for a drug like this? Who needs it for their overall health versus someone who's just trying to lose weight really fast?
Absolutely. So there's two types of obesity. Those with obesity who are overweight, and also those who are overweight who have all these other diseases like heart disease, diabetes, and actually they put themselves under cancer risk as well. So I would say start with your family doctor and your family nurse practitioner. That's the first place to start, because these medications still have to be prescribed and monitored for side effects. But I think the first step is with their family doctor. And then the WHO also recommends close follow-through with fitness instructions, counseling, as well as nutritional guidance. So those are all critical factors in success.
It's really one of 3 parts.
Yes.
Fitness, exercise, diet, and GLP-1. Okay, we're just learning more every day. Dr. Shea, thank you for coming in today.
Thank you, Jennifer.
All right, we'll be right back.